The very first thing the ER doctor said as they're wheeling in the girl who's completely paralyzed on her left side was, "It's not the shot." And I remember thinking that is the opposite of how a doctor is trained to think. A doctor, for those of you who are not doctors who are listening, we are trained to go through something called a differential diagnosis. It is hammered into you from probably the first day of medical school. You're always taught to think of the 10 things this thing could be. If a patient has a headache, you're supposed to run in your head the 10 or 15 different things that could be the cause of the headache. It's called differential diagnosis. That is how we are trained. It is antithetical to all of our training to leap out of your body and say, it cannot be this. And that's what revealed that it was kind of a religion. It was kind of a cult many of our doctors belong to. And it's very, very upsetting because doctors can do a lot of good, but they can do a lot of harm if they're not willing to listen. Have you experienced that, Dr. Murphy? It's hard to be a physician when you're open-minded because most of our peers were not open-minded.
Yeah, I have. And in fact, because I'm a little older, I did see older physicians who had intellectual curiosity when things were surprising to them, like Rick's case, and like the case of the stroke lady that you saw. But then when you're in a cover-up, there will be no questions asked about these things. And so I do see this regularly, physicians who say there's just no way anything outside of what we do could work. So they have closed their mind, they've closed, and basically are covering up any questions that would raise intellectual curiosity within them.
By the way, you happened to hint, and you didn't go down that road, but I'm just going to say something about the age of physicians. So it's very upsetting that young physicians are, in general, overall, in the aggregate, more closed-minded than older physicians. Part of it is just due to experience. You get a little humility, I suppose, with experience. You've seen enough times when you haven't been correct, perhaps. But also, young physicians are really being trained these days to be very, very, very robotic.